I've known Mark for many years. He's a very, very strong supporter, not just of the global health narrative, but of cancer missions across the globe. And he's part of the All Ireland Cancer Research Group, ACRI, as well as many other global institutions. He's also going to be taking part in what will be our first global cancer ecosystem, which will be on October the 7th. And we'll be sharing details with all the participants today for that to take part. And it does look as if we can see you, Mark. Mark, can you hear us? I love that smile. That means he's heard me. Mark, over to you.
Yeah, that you can understand. It's my only Nigerian that I can speak to be here online. I'm sorry I can't be with you in person today. What I'd like to do is continue a little bit on from what Marius has talked and just give you some examples of what we've done over the last decade in a Nigerian context and also an all-African context. One of the things that I'm really very fervent about is looking at addressing cancer inequalities globally and locally. I started this work over a decade ago in Europe, looking at cancer inequalities in Europe. We did what at the time was the largest analysis of cancer inequalities in Europe, and then used that to launch something called the European Cancer Patient Bill of Rights. And that was essentially set up, co-created between patients and healthcare professionals from across Europe. 27 different countries involved in this work. And we launched the European Cancer Patients Bill of Rights in the European Parliament on World Cancer Day in 2014. This is really important because it was something that acted as a catalyst for change to, for example, the development of the European Beating Cancer Plan that Marius highlighted earlier. It also became something that cancer patients could actually use in their daily lives in relation to the inequalities that they faced, and particularly as Marius talked about that East-West divide. And it led to us developing a European Code of Cancer Practice. And that Code of Cancer Practice has 10 different items or rights that people should expect from their health system, no matter where they live. So we're really keen on looking at whether this would also be applicable in Africa. And we certainly will be keen on talking to you about this in the Nigerian context initially, because we think this Code of Cancer Practice, which we are just looking to update at the moment, may provide a model that can be used not only in Europe, but right across the world. One of the other things I do, I'm chair of the International Cancer Benchmarking Partnership. And what we do there is we compare in different countries throughout the world cancer outcomes and try and look and see why are there differences? What are those differences and what can we use to address those differences? And one of the things we found was if you have a consistent national cancer control plan, and that is associated with better outcomes. And we developed what we call a cancer policy scorecard for cancer, national cancer control programs. And those countries that have a good national cancer control program score highly on this scorecard. So you see, for example, different states in Australia, in Canada, and in Scandinavia do very well. But unfortunately, where I live in the UK, we do not so well. So there are lessons to be learned from that. And again, we would be very keen to see, can those lessons be translated on an African and also a Nigerian context, because we feel, again, it's very useful. And the third piece of work that we've done, and this has been done through the European Cancer Organization, is development of something called the European Cancer Pulse. And this European Cancer Pulse is essentially a visualization tool that looks at capturing what are the different inequalities that we see in different countries throughout Europe. And this is really important. We've used it to develop cancer reports for each country in Europe. We've done 12 launches of that at the moment. And that allows us to work with departments of health in different countries to highlight what are the issues and to force the departments of health to actually to do something about them. So we produced the cancer report for each country, and then we highlight what are some of the issues. So, for example, in the country that I was born in Ireland, we see differences in relation to inequalities, a 9% difference between the haves and the have-nots, and that's just not acceptable. If we look at it in Bulgaria, we see in relation to HPV screening and HPV vaccination. We see differences, significant differences with the rest of Europe. If we look at it in the context of France, we see differences in relation to breast cancer screening. So every country, no matter what how advanced it is, they all have some issues associated with them. And it's again this idea that Marius talked about, this idea of working together, learning from each other, establishing best practice, seeing where research and innovation are important, applying them in a way which is very much directed towards improving the outcomes for cancer patients. The other thing that's really important and that I've focused on a lot in the last 5 years particularly is the cancer survivors. So in Europe, we have, for example, nearly 20 million cancer survivors. So that shows we're doing better in relation to our work in terms of developing better diagnostics, better treatments, etc. But that means that we have to address the issues that these 20,000 European cancer survivors face. And we feel that we're not doing enough in that setting. So how do we address things like long-term responses to different treatments in terms of complications? How do we provide the best life for those cancer survivors so that they can return to work, they can look at having fruitful, productive lives, they can go back to work, they can go back into the community. And this is a really important part. So as well as early diagnosis and prevention to prevent cancer, and then treatment to treat the symptoms of cancer, we also need to be thinking of those patients who we've successfully treated and are still alive. But what are their particular issues? What do they face that we may be able to help them with? And one of the things we've been looking at is developing a European Cancer Survivor Plan. And again, we would be interested in talking to you in Nigeria to see how relevant that would be. Are there some lessons that can be learned in relation to how we work together? Looking at how we work together as well is really important to identify what's the important things in different countries. And I'll just give an example. If we look at, we did a study, a large study, the most comprehensive study of cancer research in Europe. It was called the Lancet Oncology European Ground Shock Commission. And what we found was that if you look at a disease like lung cancer, which is 21% of the disease burden in Europe, we are only looking at, in terms of our cancer research effort, it's only at 4%. So even though the lung cancer has a burden in terms of 21% of all the cancer burden in Europe, we're only expending 4% of the research effort, and we're only spending 4% of our cancer research budget. So there's something wrong there. So one of the things, I hope the lessons that you learn from my brief talk is that we need to have data intelligence that informs us what are the things we're doing well, what are the things we're not doing so well, what are the things we're not doing well at all, what are the things that other people are doing that we may be able to learn from, and use that data-informed, patient-directed approach to addressing cancer. And we feel that if we do that, we can look at really ways in which we can address cancer in a much more meaningful fashion in terms of improving outcomes, improving quality of life, getting people back reintegrated into society. And in that sense, looking at how we can do that in Africa and in Nigeria in particular, we'd be very keen to explore ways in which we can work with you more fruitfully, particularly in relation to the Global Alliance that Andy is obviously representing us there on. And one of the things that I'm really keen on is how we look at this in the context, not only in relation to cancer inequalities, but how do we also provide cancer services in conflict regions? We have a lot of conflicts around the world, including in Africa. And one of the things we did recently was produce a manifesto as to how we actually help cancer patients and cancer survivors, particularly in areas of war and conflict. And again, obviously challenges in South Sudan, for example, make it not just a European problem or a Middle Eastern problem, but a global problem. So they were sort of some of the examples that I wanted to give you of how working together really makes a difference. I'll put some of these in the chat so that you can actually look at them in more detail if you're interested. I'm very happy to looking at developing the conversation as to how we can expand some of these efforts where they would be relevant and adjust them to address some of the issues that I've heard earlier that you've highlighted within the conference that you're facing. And some of these issues are common issues. We all face them. So again, cancer knows no borders, so we need to look at ways in which we can work across borders to help each other. And the other thing is we should be competing not against each other, but against our common enemy, which is cancer. Thank you very much indeed.